Okay, so I'm dressed according to College of Nursing policy. So I'm going to start out by reviewing the medical order for the wet to dry dressing change and hospital policy. And then I'm going to gather my equipment. So I have my sterile gloves, my dressing change tray, I have my goggles, my tape, my clean gloves, and my saline. So now, after I gather my equipment, I'm going to perform hand hygiene. And then I'm going to come back over to the patient and identify the patient using two patient identifiers. So Jaguar Jones, medical record number, medical record number. I'm going to explain the procedure to the patient and tell him that I will be conducting a wet to dry dressing change. I'm also going to note that he is allergic to penicillin. So I'm already going to make sure that the linens are spread away so that no gown or linens come into contact with my sterile hands. I'm going to position the trash can. I have it right here below me, and then I'm going to perform hand hygiene. Then I'm going to provide privacy, raise the bed up to a comfortable working height, and lower the side rail. Now what I'm going to do is I'm going to don my clean gloves. And my goggles. Okay, so after I have my clean gloves and my goggles donned, I'm going to make sure I have a comfortable working environment, and I'm going to start by removing the tape on the open wound, and I'm going to move the tape inwards towards the dressing, trying to be as gentle as possible to provide comfort for the patient. I'm going to move the dressing away from the patient, and I'm going to note the type of drainage, the amount of drainage, the color, the consistency, and whether or not there's an odor. So now I'm going to remove the inner dressing, being careful not to touch the peri-wound area. And now I'm going to inspect inside of the wound for the type of tissue. So whether there is granulation tissue, if it's necrotic, slough, and also if there's an odor. So now I'm going to palpate the peri-wound area, noticing if there's any tenderness, redness, or edema. Okay, so now I'm going to ball this up in my hand. I'm going to remove my clean gloves using glove to glove and skin to skin. Okay, glove to glove, skin to skin, aiming towards the trash can down. And now what I'm going to do is I'm going to open my dressing change kit, making sure I still have a comfortable working environment. So I'm going to open the dressing change kit away from me, and I'm going to pick up the sterile field, making note of the 1-inch sterile border. I'm going to pick it straight up, grasping the 1-inch unsterile border, placing the white side up. Now what I'm going to do is I'm going to dump my contents onto the sterile field, making note of the 1-inch sterile border, not letting my thumb touch the inside of the container and not letting the container touch the sterile field itself. Okay. I'm going to sit this back down. And now what I'm going to do is I'm going to get my saline bottle, and I'm going to grab my saline and I'm going to check the expiration date, and it's still good, it's within date. I'm going to palm the label of the saline. I'm going to open the cap. I'm careful not to splash the sterile field or touch the bottle to the inside of the container. I'm going to pour my saline. Okay, now I'm going to recap the saline and place the saline over here. Careful not to turn my back away from the sterile border. So now I'm going to don my sterile gloves. I'm going to make sure to open the package of sterile gloves away. And I'm going to discard this in the trash. Okay. So making sure I still have a comfortable working environment, I'm going to grasp the edges right here and open it up. So I'm going to start with my non-dominant hand and start at the cuff. I'm not going to readjust just yet. I had to move the gloves because they flipped over. Now I'm going to don this glove. I can adjust when they're fully on. Don't worry about it yet. I'm going to adjust. Okay, and I'm not going to even worry about the cuffs. So now I'm going to organize the contents that are on my sterile field, making sure not to get them anywhere near the 1-inch border. Just go ahead and sit them to the side for right now. So what I'm going to do now is I'm going to place 2 of my dry gauzes over here to the side because I will need 2 dry gauzes later. And I'm going to take these gauze and place them into the saline. Careful not to touch the container itself. And I'm placing these in one at a time. Okay. Now what I'm going to do is I'm going to move over to the intact suture one. I'm going to start by inspecting the approximation of it and if it was intact by sutures and if there's any redness or swelling and making sure that it is completely intact. And so I'm going to start by cleaning the intact suture line. So I'm going to take one of my wet gauzes. I'm going to wring it out. I'm wringing the excess saline out. And I'm going to position the gauze to where my fingers are not going to touch the suture itself. And I'm going to start from where it is the least contaminated, which is straight down the middle of the suture. I'm going to dispose of this into the trash well above my waist. Okay, squeeze it out. Position it. Clean down the side. Dispose of it well above my waist. And once more. Position it, clean down the side, and dispose of this one well above my waist. Then I'm going to take one of my dry 4x4s, and I'm going to pat the incision dry and dispose. So now what I'm going to do is I'm going to move on to the open wound itself. And I'm going to start by packing the wound. So I'm going to squeeze out the excess, and I'm going to fluff this, this gauze. Because you want to make sure that the wound is packed all the way up to the top, but you do not want to pack the wound too tightly. So make sure that it's good and fluffed. You're going to take it and just place it in. Careful not to touch the peri-wound area. And do the same thing for the next gauze. Okay, I'm going to take it and I'm going to fluff it. Lightly pack it. Now I'm going to take my next dry dressing and place it over the top. And then what I'm going to do, once I have the dry dressing over the top, I'm going to take my AMD pad, just touching the top, and I'm going to place it over, blue towards the sky. Now after I place the abdominal pad, I'm going to remove my sterile gloves. So I'm going to start by doing glove to glove and skin to skin, placing it in the trash. And then I'm going to get my tape. And I'm going to measure the amount of tape that I need for each side of the dressing. I'm going to do this to all 4 sides. And now what I would do is I would take one last little piece of tape and place it on the AMD pad, and I would write my initials, the date, and the time, but I'm not going to do that today, but I just wanted to verbalize that. So now what I'm going to do after that is I am going to perform hand hygiene. I'm going to go ahead and wash my hands. And then I am going to dispose of my equipment. And then what I would do is I would document. So I would document the assessment data for the incision line, the assessment data for the open wound, and how the patient tolerated it. And that's it.